How good are results after follicular unit transplantation surgery without using the drug Propecia? I'm a 31-year-old male interested in FUT surgery. I do not want to take Propecia after my surgery because of side effects. If I don't take this drug post-surgery, will my hair continue to fall out and I would have to get another procedure down the line? Am I a class 6 on the Norwood scale? How many grafts do you feel it would take for my hair to look fuller again? Would I need more than one procedure? After procedure, if I use the hair fibers Toppik, would it affect growth of new hair coming in?
Thank you for your question. You're asking how good are FUT results without taking Propecia. And you've asked a series of very typical questions that people ask regarding hair transplant surgery. You state you're 31 years old, you are a Norwood 6, which is fairly advanced, and you're asking about how many grafts you would need for fullness, what would be the possible necessity for a second transplant, would you keep losing hair afterwards, and of course, would Toppik be, or hair fibers, be problematic after surgery? Well, I could certainly give you a lot of guidance with this question, as this is a typical question we deal with in our practice every day. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice over 20 years in Manhattan and Long Island. I perform hair transplant surgery, and I'm also the founder of Trichostem Hair Regeneration Centers. We developed in our practice a method of using an injection to stop the progression of hair loss for both men and women with genetic pattern hair thinning, as well as reactivate hair and improve the appearance without surgery. So to begin with your question about what would happen in terms of the progression of your hair loss, I think it's fairly self-explanatory. You're 31 years old, you're already a Norwood 6, your hair looks fairly thin, and it is inevitable that you will continue to progress. There's a general rule of thumb when we talk about hair loss incidence. Men in their 20s, 20% are affected by hair loss. Men in their 30s, 30%. So when you think about it, you're a relative minority in terms of your relative advanced level of hair loss. So you had an early onset and relatively rapid progression. When it comes to transplantation surgery, when we perform surgery, we estimate numbers of grafts, but when it gets down to it, you are limited by the actual available grafts in the donor area. Typically, a younger man with advanced hair loss tends to not have that strong of a donor area. When I say that, I mean the hair tends to be relatively thin, tends to have relatively low density, which means that when you think about an individual hair follicle or hair strand, you're talking, if it's a thin hair, it covers less scalp than a thick hair. What I tell my patients is, before transplant, that if we're going to do FUT, or otherwise known as the strip method, I'm going to take out the widest strip I can that can allow for good closure and will give me as many hairs as I can possibly get for a transplant. Why do I do that? Well, because invariably people do need more than one transplant, and we don't want to put stress on the closure of the scalp in the donor area and diminish and compromise the viability of hairs that could be used in the future. As far as the progression is concerned, I would say that before doing a transplant, you want to do something to stop progression. And this is where I can help you understand what we do in our practice for people like yourself. The first thing I would recommend, if you can't take or won't take finasteride, and you're in good company, I would say the vast majority of men who come to our practice, and people come to us from all over the world for hair regeneration treatment, will not take finasteride or cannot take finasteride because they took it and they had side effects. What I would say is hair regeneration would stop the progression of your hair thinning, will reactivate hairs that are not growing, which is part of the characteristics of male pattern hair loss, and as well as allow thinning hairs to shed so that thicker hairs will grow in. Stabilization is critical. Maximization of your existing hair, or maximizing the quality, the volume, the coverage of your existing hair is critical before considering transplantation. Once that's established, it is not unusual to then consider maybe doing another injection. We often, in people who have very advanced hair loss, will do a second injection around 15, 18 months, depending on how they look. And we can then finally feel like we've used every hair follicle we can to get the best result we can non-surgically. More importantly, to stop the progression. When we look at our results, even with just thinning hair, we have been able to get better coverage with a non-surgical treatment than we can with transplantation, particularly with men like yourself who have existing thinning hair. And why is that? Well, one of the harsh realities of hair transplantation in someone who has existing hair is that there's collateral loss of existing hair because of the trauma of making sites. When people say that I'm getting 1,500 grafts, 2,000 grafts, what are we saying? You're getting 1,500, 2,000 holes made in the scalp. What's the problem with that? Well, unfortunately, existing hair will be lost. A certain percentage of native hairs get lost with hair transplant. Where's the exception? Someone who has smooth, bald skin. So what I've been able to help people with is taking their existing thinning hair and making it thicker to the point where they get better coverage and it's their existing hair, so they don't have to have surgical placement of hairs and they don't have to lose existing hair in compromise for transplantation. It's something that's kind of understated in hair transplant because unfortunately it is the reality and the limitation. Before we developed hair regeneration, we accepted this as part of the reality. It always made sense to, even if you lost thinning hair, it was going to go anyway. We're now going to replace it with a thicker, more permanent hair. Now with hair regeneration, we have a different perspective. So learn more about your options and learn about what your limitations are with transplant. Think stabilization before you think transplantation. It's critically important. Otherwise, you're going to find yourself a little bit older and you'll continue to lose hair and your grafted hair will not look so good. We have seen many, many people like that, and unfortunately their hair went away too fast for their grafts to make enough of an impact for them to enjoy the benefit of transplantation. It's the harsh reality of people with very thin hair who have early onset and rapid progression. So make your decision from an informed state of knowledge before you move forward with surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.